Hello y'all, I hope you're excited for another video on Path to Passing, less than 5 minutes. We're gonna break down the vertebral arteries, okay? If you know, you know. These can be very tricky to get and to understand in ultrasound, but that changes today. All right, so we have vertebral arteries, and a lot of the videos we've been talking about recently have stemmed from the aortic arch, okay? The aortic arch is a very important component in understanding your arterial anatomy. So you have the ascending aorta, the aortic arch, and a descending aorta. Off of the aortic arch, you have your brachiocephalic trunk, you have your common carotid artery on the left, and your left subclavian artery. So off that brachiocephalic trunk comes your right subclavian artery. Your right subclavian artery gives rise to your vertebral artery, okay? So on both sides, your vertebral arteries come from the subclavian arteries, all right? So let's make sure we understand that. And this is just going to be your left common carotid artery, and this is going to be your brachiocephalic trunk and your right common carotid artery. All right, so your vertebral arteries, these arteries supply, let me get my pen. These arteries supply the brain and the spinal cord. Why am I yelling? I literally have a mic on. Why am I yelling? Anyways, the vertebral arteries supply the brain and spinal cord. And it says, number 2 says, should be blank color on ultrasound. So if you're an ultrasound sonographer, what color would you expect the vertebral arteries to be? The correct answer is red, okay? You want it to be red. So a good hack is to put your carotid artery in the same photo as your vertebral artery and make sure they are going the same direction. They both should be red on ultrasound, okay? If your carotid is red and your vertebral is a different color, that's a problem. So then it says color reversal would indicate blank. So if you have a blue vertebral artery on ultrasound and it is not due to poor technical factors, then what abnormality or what pathology would you expect to see to explain the opposite direction of flow in your vertebral? All right, I'm gonna give you the answer. It is going to be subclavian steal, okay? Subclavian steal. And sometimes people call it subclavian steal syndrome. Okay, so that is reversal of flow in your vertebral artery is subclavian steal syndrome. We'll talk about that in a second. So your vertebral arteries run through the spinal column. So on ultrasound, you tend to see your bony spinal column, and then you would see in between the bony spinal column, you would see your vertebral artery, okay? So me personally, when I take my ultrasound photos, I like to see two portions of the vertebral artery in my photo with the spinal column, but of course, that's just me and my technical factors. And then number 5, it says vertebral arteries join to form the blank artery. You may not know this one, so I'm gonna go ahead and give it to you. They join to form the basilar artery, okay? I'm gonna put this a little closer. I realize I'm in y'all light. Let me move over. Okay, so there's that. So subclavian steal syndrome. Subclavian steal syndrome is a situation where blood is being stolen from the brain, okay? The vertebral artery is supposed to go and supply blood to the brain and spinal cord. So when you have reversal flow in the vertebral artery, then there is an issue with flow and it's being stolen and being shunted to the subclavian artery. So usually when I have found subclavian steal, there is usually some form of a thrombus or plaque built up in the brachiocephalic region or in the proximal region of my right subclavian. So usually because of these two, blood is being sent backwards in the opposite direction to give flow to the arm instead of going to the brain. So that's where you get the name subclavian steal syndrome, because the subclavian is stealing blood from the brain. Yep. So there's that 5-minute breakdown of the vertebral arteries. Please go ahead, like, comment, and subscribe. And I can't wait to see you on the next video.